Thank you for joining today's virtual presentation as a part of our 2021 Global Health Leaders Conference at Johns Hopkins University program. We're very happy to have Dr. Shereef Elnahal at our conference today. To briefly introduce Dr. Elnahal, he is President and CEO of University Hospital in Newark, New Jersey. He was formerly New Jersey's 21st Commissioner of Health, the Assistant Deputy Undersecretary for Health, Quality, Safety, and Value in the U.S. Department of Veterans Affairs, and was a White House Fellow selected by President Barack Obama. Dr. Elnahal received his MD and MBA from Harvard and went to college at Hopkins as a biophysics major. Dr. Elnahal, we're very grateful to have you at our conference today. You can feel free to begin whenever you're ready.
Thank you, Siam, and it's great to speak with all of you. I'm really happy that Hopkins is able to convene such a great group of people in high school who are interested in potentially going into the biomedical or health sciences or global health. And I think medicine is a great career path. If you consider it, you can just sort of think about how many possible things you can do. It's really just an endless list of what you can do with a medical degree or with a science degree. And so hopefully I can give you one lens of a path that you might be able to take in your careers going forward, which is one of public service. I've always thought that public service is really the most motivating thing for me. The fact that I can, get up in the morning and understand that every time I go to work, I'm helping someone and I'm in service to someone. And there are a lot of different ways to be able to do that within service in government or service in NGOs or service in any organization that helps people and interacts with government often in the process. But it's something that I really devoted most of my career to. And so the lens that I'll be talking about today is, sort of how I proceeded through my career and what we faced over the last year and a half out of University Hospital. So for everyone's knowledge, I'm the president and CEO of University Hospital in Newark. That is the academic medical center for Rutgers, New Jersey Medical School. And so my colleague hand in hand is the dean of Rutgers Medical School. Both of us run all the operations here on campus in Newark, and we run the main academic hospital in Newark and serve the most vulnerable people in the city by far. We provide the most charity care out of any hospital in New Jersey, and we do so proudly. I think without this hospital, so many people would be left behind in terms of their health care, and to be able to get up in the morning every day and do that is just something so rewarding. But let me just sort of rewind and take you through my career over the next 25 minutes or so. And I do want to leave a bulk of this time for questions, comments, thoughts, and to learn from you, frankly. I want to know what your perspectives are, what your concerns are for the future, because you will be leading this country, whether you like it or not, in 20, 30 years, or even sooner than that. And I think, to have your sense of things and where you see the world going from your perspective is just only helpful to me as I proceed through my path. So I'll start with the fact that I've worn several hats in health and healthcare. The first hat I've ever worn is I'm a patient. I'm somebody with type 1 diabetes. It's a type of diabetes that is juvenile, and you get it when you're a child, and it's caused by autoimmune disease. And so it's really when your own immune system is attacking your cells and causing disease. And in the case of diabetes, and your immune system attacks the cells that produce insulin, you're no longer able to control your own the amount of sugar in your blood, which is a very important thing to stay regulated for a lot of reasons. And so I have the type of diabetes where my own immune system busted up my pancreas and I can't produce insulin on my own anymore. So my life depends on insulin. I wear this, it's an insulin pump. It's attached to me 24/7. It delivers insulin at a consistent rate. And whenever I eat something, I have to dial up more insulin if there are carbohydrates in there. So I've lived with that disease since I was 12. I didn't handle it well when I was first diagnosed. I wanted to be an irreverent kid and not listen to anyone. And so when that happened, I was in and out of the hospital. I was super unhealthy. And even though I had two parents in the medical field, it didn't matter. That often that doesn't matter as much as other people might in your life. And so I ended up really having a bad first few years with the disease. But what changed that is actually, my parents were essentially fed up with me, and they sent me to University of Pennsylvania to see a nurse practitioner who specializes in educating kids and adolescents who were recently diagnosed, like a specialist. And yeah, she was a wizard at what she did. She somehow identified with me as a 13-year-old, and related to me in a way that really convinced me to take my insulin on time and check my blood sugar. For anyone who has it or has family or loved ones or friends who have it, it's not a disease you can think about, you can forget about. You have to monitor it every day. You have to make sure your blood sugars are controlled. And if you don't, really bad things can happen to your health, including hospitalization, and, intensive care unit time, and maybe even death if things get really bad. And so, it was a pretty bad situation where my own family was worried about me to a point where they sent me there. But lo and behold, I had an amazing experience with her. And she really taught me what clinicians can do for people. And so it wasn't a doctor who convinced me to go into medicine. It wasn't even my own parents, both of whom are doctors. It was a person who, related to me as a person, and also embedded her expertise in the process and made me, just left an impression on me forever. And because of that, I decided to go into a major in sciences when I was in college. And I did that, but I also decided to try to pay it forward in terms of what I received in diabetes education and volunteer at a local federally qualified health center. For folks who don't know what that is, it's a type of clinic that is funded by the federal government to serve people mostly lower income, Medicaid, or don't have health insurance at all. And they receive reimbursement for care for people even if they don't have insurance. There's a provision for that in what they do. And so by definition was helping and trying to serve the most vulnerable in the city of Baltimore, and taught a diabetes class with a more senior person, just assisted her in her diabetes curriculum for new patients. And in the process, I met a kid who was so into it, and his mom was so enthralled by the fact that her son was finally sort of getting traction and learning the disease, that they asked me to do, some private sessions with him because, it was going well and they thought there was potential. And so he would show up every Saturday morning. I'd get up and go there and, bring my own experiences to bear, and how I tried to educate him on how to manage his disease, checking blood sugars and what have you, and really tried to do what the nurse practitioner did for me at University of Pennsylvania. And it worked. We really started to get his blood sugars down, his hemoglobin A1C, which is sort of like your diabetes report card. That was improving really well over the next couple of months. And then I got a call I'll really never forget. His mom actually called me. We'd gotten close alongside him. And, she told me that he passed away. This was in November, and gotten to know him over the previous summer. And so, of course, the first thing that entered my head was, oh God, what happened? Was he low blood sugar while driving? Was it a diabetes complication? Where did we mess up? And it was none of those things. He was shot on the streets of Baltimore because he had gotten in with the wrong crowd and started selling drugs. And, that was a pretty rude awakening for me, that really no matter what I did and what I focused on, it was ultimately not the most important thing. The most important thing was his social station and what the support systems were around him and what his exposures were. And, he had actually told me just weeks prior that he had gotten a new job, and I didn't bother to ask what it was. And if I had, I would have learned that it was a job that really was really putting his health and life at risk. And so, that taught me that really everything we try to do in clinical care is only a small percentage of the equation for, vulnerable people and what happens to them in life, including with their health. In fact, only 10% of health outcomes are due directly to clinical care. Most of it is either social risk factors, genetics, and other factors that have nothing to do with what we do in clinics or hospitals. And so all of that data made sense to me because I saw it myself when I learned about it. I had seen it with what I did in college. And so I knew at that point that I had to learn something from this. I had to do something with my career that prevented this from happening to more people to the degree that that would be possible. And so when I went to medical school, I searched for other opportunities to understand social determinants and make progress on systems of care, not just individual care and face-to-face care that you do for one person, one at a time. And my process and my interests led me actually to a business degree. I got an MBA where I went to medical school, same university. And it was because I really was interested in implementation and shorter term, seeing the shorter term outcomes of what I did. A little bit impatient as a person. And so policy is something where you see the outcomes like the years down the road, decades down the road. And so what you're working on now, you don't get to see the fruits of it as quickly as you do with management and as you do with implementation, being able to actually do things and execute on an organizational level. And I found that that was what was most interesting to me. And so I got that education, got through the first part of my residency and decided to apply to something called the White House Fellowship, which is a program where folks who have never been in the federal government, early career, usually sometime after graduate school, right after graduate school, they get a federal government experience where they're paired with a very senior government official, usually either a cabinet member or immediate sub-cabinet member like an undersecretary. And I applied because I saw that there was a crisis brewing in this country on veteran healthcare and the fact that veterans were waiting too long to get their preventative and longitudinal care to a point where their health was compromised. And so that was mostly a problem with integrity. People felt pressured. And so there's this concept of fraud. How do you understand fraud? Really three sources of fraud: opportunity, pressure, and extra incentive to do it. And so all three of those things were in play in the VA, and people were lying about how long it was taking for veterans to get their health care. And so these are things I had learned about and had done some research on: operations management and healthcare. How do you make healthcare more efficient? Focused a lot of my research and my extracurricular work in medical school on these areas. And what better way to try to apply that, even though I was green, except to try to help chip away at this issue in the federal government. So that's what inspired me to apply to the White House Fellowship. It was the last year of the Obama administration, and I just went for it. And I think I was the second youngest in the cohort who applied, who ultimately got accepted. But I was pretty clear about my interests, why I was applying, and how my experience as somebody with type 1 diabetes and as a Muslim American growing up really just sort of inspired me to get into public service. And so ultimately was fortunate enough to get it at the end and was appointed to Veterans Affairs. So I found myself in a position of at least leadership by influence when I arrived there, because I had the ear of both the Secretary and Undersecretary for Health on the very crises that were hitting the VA at the time and how to solve them. And I learned a tremendous amount from those two, and I learned a tremendous amount from my colleagues at central office in DC, but I learned the most from people on the front lines of healthcare and the hospitals. And in fact, that's what I focused on when I was in the VA. I focused on elevating and understanding excellent work in a 170 hospital system and how you understand, replicate, and ultimately scale those best practices across the system. And we really developed a framework for that allowed me to write papers in the Journal of the American Medical Association and gave us a lot of opportunity to show what work can be accomplished on a national scale with just leadership by influence and consensus, because nobody reported to me at the time. And so because of the success of that effort, and because we had such a great team informally that I had assembled as a fellow in the agency, that was able to scale best practices and care for women veterans and LGBTQ veterans, and programs for opioid abuse, how to prevent suicide in the veteran population. A number of these best practices we really had success in learning from in DC from a bottom-up approach, and then spreading it to so many more people. And so, that was just such an inspiring thing for me. And we accomplished so much that I found myself in a position where I was lucky enough to be offered the Chief Quality and Safety Officer position of the VA when I was 30 years old. And so I don't think anybody that young had been in that seat before. And so I came in eyes wide open, ready to do great work and learn, and found myself in a very interesting spot where I got the job, and the person running for president in 2016, who I thought was going to win, didn't win, but was lucky enough such that the selection of President Trump was actually the person I worked with a lot in the previous administration under Obama. And so I ended up staying on for the next year and a half, 2 years, because I believed in his vision, and ultimately got a lot done in that position as well. But then got an opportunity and a phone call to go back home and serve. Phil Murphy was running for governor of New Jersey at the time. He's the current governor, and ultimately had just gotten elected. And I was asked to serve on the transition team because of the work that we had done nationally in the VA, and the fact that more and more people were learning about it. And so that was totally unexpected, and responded pretty enthusiastically because it was an opportunity both to go home and be closer to my family, but also serve my state and do so in a position that I never thought I'd have the opportunity to do. And so I was nominated to be Commissioner of Health in New Jersey, and ultimately got that job, and was one of the best experiences of my career. We made so much progress in healthcare interoperability, health information interoperability, the opioid epidemic. We expanded medical marijuana for more and more people, including veterans. That was a passion that really didn't escape me after I left. But also just so many important areas around maternal child health, Black maternal mortality, Black infant mortality. The issues that even if you have an overall low rate of mortality, infant mortality in a particular area, but the biggest disparity in the country, which New Jersey has, between Black moms and babies and the general population, that's inexcusable. You can't declare victory on that. And I tried to emphasize that explicitly, that you had generations of systemic racism and overt racism through federal policies and state level policies even, that led to these worse public health outcomes. And we really spent a lot of our time alongside the governor and the first lady in New Jersey, iteratively making policy changes to make sure that people got the access to the care that they needed. And one particular program that I was probably proud of the most is setting up a doula program, a program for women who are on Medicaid can get access to a doula as a covered service under Medicaid. And I worked with the Human Services Commissioner to do that. And in the process, got to know Newark, because that's where our most successful branch of the program was. I got to know local elected officials there, city council. I got to know a lot of people in the state legislature just from my state level job. And I got to know the mayor of Newark really well, and all the leaders there, and really ended up having great relationships that made me want to apply to this position when it became open. And so I did. And now I'm in Newark full time, leading the public hospital, leading the academic hospital. It's really been the honor of my life. I'll say a few words on COVID, because that's been dominating my life. It's been dominating your life. I can't think of a single person that COVID hasn't affected. But I do think that at hospitals, people who work in hospitals, I'm sure you have people in your network who do, went through something that people should never have to go through. And over the last almost 2 years now, we've seen just horrific things that, if we do our jobs right, we should never have to deal with again as a country. The fact that I was within days of running out of PPE from my staff, and I was on the phone myself with suppliers who were telling me no left and right. The fact that we were excited to receive shipments of PPE from China, only to find out that they were fraudulent, and I had to throw them away because I couldn't give things that didn't work to my employees. The fact that a third of my nurses were out sick or out caring for a loved one, or otherwise out, leaving just ratios of nurses to patients that were untenable. The fact that we had to have frozen trucks outside of my hospital because our morgue space ran out. The episodes that I'll never forget where I was literally carrying boxes of PPE to nurses on the front line one night. And I just remember talking to a woman who is a mother baby nurse. My wife and I had our third kid right before the pandemic exploded. So I had just been in the mother baby unit literally weeks before. And she was in tears. She had 10 patients who were severely short of breath that she didn't know how to take care of because that's not her specialty. And, that conversation made me make a decision around giving hazard pay, because even though we couldn't afford it, because we were a safety net hospital and I was worried about having to close my doors in the middle of a pandemic 2 months later, I said, you know what, if we have to close our doors, we'll do it doing the right thing. And I couldn't possibly not give people hazard pay for what they were doing after that one interaction. And of course, I've had many others since then, where people were in desperation, where it really felt like a war zone. But that experience really taught me that no matter what you're doing, if you're ever in a position of leadership, to lose sight of, or to not make the active effort to get that perspective from the people whose lives you're responsible for. And my employees, I really view that. Part of my job was to protect them while they were in the line of fire in this pandemic. You will make mistakes. And a mistake I almost made was not giving hazard pay because of some financial reason. And so I'll never forget that interaction. I'll never forget the last 18 months. I actually threw on PPE, and now we're talking about the full bodysuit PPE for this. That's what our pathologists and EMS staff wore when they were carrying bodies from the morgue into these trucks. And I couldn't imagine what that was like. So I decided to drape myself up in PPE and do it with them. And, the degree to which these folks who did this day after day treated everybody with the utmost respect. I'm fully confident that if any of you or I had a loved one whose body had to be moved in that scenario, they would have felt that their loved one was treated with respect. And to do that under an intense amount of stress and pressure. And this is just one example of so many others that aren't maybe not on the front line going into patient rooms, but we're there, 10, 12, 18 hours sometimes, fixing this or that, or making the environment of care suitable, making rooms negative pressure, altering our ventilation system, cleaning the rooms. It didn't matter what people did. They were saving lives. And I made that clear we were having weekly town halls at the time, so I could update people as much as possible. That, this was, I think, the best team I'd ever worked with. And I continue to believe that today. We have a team at University Hospital drawn from the community. We have an incredibly diverse staff from the community. We hire more people from Newark than any other organization in the city. We procure, with my direction over the last 2 years, more from the city than we ever have, empowering minority women and veteran-owned businesses in the process. And we've been able to turn around the finances of the hospital as well. And I don't say this to brag. I say this as hopefully a data point in all of your heads that, just by virtue of being in this session, you're statistically likely to be a leader at some point, whether you like it or not. And so when you are in those positions, if you fail to recognize that your success depends entirely upon everybody who you supervise wanting you to succeed as an individual, if you fail to recognize that, you won't succeed in that leadership job. That is the most important determinant for any organization, especially large ones. And especially where no matter what I do, I will never be able to get to know the 3,700 people who work for me personally or well. But if you conduct yourself in a way that shows that you care about people and that earns people's trust, that is the most important ingredient to success, because the friction with any change is really, really, really hard, especially for people who've been working in an organization for a long time, and especially in healthcare, where change is much harder, I think, than in many other areas. And I had to ask my folks in that hospital to change overnight to respond to that pandemic. And so had I not invested in the workforce and tried to reestablish trust from the day I got there, I had about 8 months from when I arrived until when this thing hit, and I was getting 5 admissions, 10 admissions, 20. It was literally exponential increase of people coming into the hospital. That time span was only about 8 months, but I spent most of it not cracking down on, people ordering staplers and erasers and stuff that people focus on when they just try to save money in a cheap way or a thoughtless way, or certainly firing people, layoffs, reduction in force. These are the mindless, easy ways to claim victory in any organization. But I knew that wasn't the right way. And, I think that investment paid off. It got us through the pandemic. We lost 12 people. I have their names on my desk. I know I see them every morning. We had a memorial for my employees who died in the lobby of our hospital, where we had essentially 12 trees, and each tree had the picture of one of our team members who had passed from COVID. And everybody in the hospital had a week to write notes to the person or to that person's family and hang it for any individual they were close to, or any individual they wanted to, even if they didn't know them. I hung a note on every single tree. And we also had a 13th tree. And that tree was for anybody who would pass away after that date, because we knew that the pandemic wasn't over, and it's still not over, even though we're in a much better place now. And I think if there were people who didn't trust me up to that point, most of them ultimately came around, because that was a true, genuine expression from my part and from everybody's part who helped me set this up. A sense of responsibility and accountability, but also a way to share the pain that we felt in the hospital for our loved ones who passed away. And so the areas you want to go into around global health, public health, clinical care, whatever it is, and you won't know for a while, because you need to go to college, and you need to be just go through that journey. But you realize how serious that is. And I think this is a generation, your generation, that really understands the gravity of health in ways that others didn't, including mine when I was your age. And so it's stressful, but it is so rewarding, and it's such an honor to understand the meaning of what you do in healthcare. And again, you can pull levers that help people on a massive scale or on a small scale within a community. I've worked at the federal level. I've worked at the intersection of Bergen Street and South Orange Street in Newark level. And the scale of it doesn't matter as much as feeling and understanding what you're doing for people. And you'd be going into a field where it's easier and it's more visible, and you can feel it more easily than many other fields. And hopefully, if you're on the fence and you're deciding, there's a lot of reasons to go into a lot of careers, right? Are you going to be flying private jets if you go into healthcare? Maybe not, and probably not, frankly. But I'll guarantee that if you follow your motivations and what makes you inspired within this field, you'll find something guaranteed. And there's a lot of ways to do that, and there's a lot of pathways to do that, and some of them have nothing to do with clinical care. They can just be around epidemiology or behavioral health sciences, basic sciences. There's a whole host of things you can do, but the impact is really tremendous. And I hope I provided a slice of my experience that gives you an impression of that today. And best of luck to all of you. I know you're still young, so enjoy it, and I know you'll be amazing leaders into the future.